There is so much that has been done, but obviously there's a lot more that needs to be done to be able to achieve this transformative agenda that you are leading us into. So, Your Excellency, here in Mombasa, we are committed. We're improving on our infrastructure. We're improving on our human resource capacity. You know, initially, people thought it was a joke when this agenda on transforming the health system in Kenya had started. Your Excellency, I sat in a room where, here in Mombasa, at Coast General Hospital, I monitored on a CCTV a first ever open heart surgery done in Coast General. And it was not a joke. It was not a joke. We have completely utilized the MES equipment that was given to us. We even asking for more. I was telling my brother Mutahi, if there's any place that you see that anything has not been used, we're very receptive to take, because we are transforming and saving the lives of the people by providing good quality, high standards of health care, primarily at their place where they reside. So we are decentralizing, we're looking at reproductive health, we're looking at primarily preventive agenda. We are now focused here in Mombasa on creating level fours at every sub-county. We have built 2 in Likoni, 2 in Kisauni, now we're building 1 in Changamwe, we're building here in Nyali, so that we continue to achieve this very important agenda that you have identified with, Your Excellency. Atuchukuli rahisi, agenda hii ya afya ni muhimu kwetu, na tumeona kazi ambayo imefanyika. Wazi ni kwamba tumefanya kiasi, lakini ni kazi mingi zaidi ambayo tunahitaji tuifanye na tunaifanya. So mimi nashukuru na natoa commitment kwa serikali ya kitaifa, na hasusan namna mienendo ya uendeshaji wizara, hasa chini ya Mutahi Kagwe na wenzake, the 2 CAS and the PS. Milango inafunguka, tunazungumza. There are issues obviously. Kama sasa mimi nataka nikipata muda niongee na huyu ndugu ya NHIF nimwambie from now on going forward, kwa sababu sisi ndio tunakuwa responsive to the demands of the people. Scientifically, we're the custodians of the research. We're the custodians of the information. So even the way we invest going forward is informed by the reality on the ground. So nataka kuambia NHIF, look at your statistics. Utakuta kwamba asilimia kubwa sana of your engagement probably is with private hospitals. The president cannot direct private hospitals to do certain things, because whatever they do, priority for them is how lucrative economically it may be. But for me here in Mombasa, if I get a call from CS or the president, I'm told, from the resources that you've earned, let us invest on a certain or specific care of a disease or something, it is easy to do that. But you cannot call a private hospital, mwambie wewe enda ujenge kitu ya kutibu ugonjwa fulani. You cannot. So we need a shift. Instead of hearing that 70% of NHIF is private, we want to hear 70% of NHIF is public. We're working with Mutahi on a radiotherapy. It's almost complete. We here as a county, and hopefully the president will be able to come in and launch our cath lab, state-of-the-art modern cath lab, ever in a public hospital shall be here in Coast General. And we want to keep investing, but that can only be achieved when there is a lot of goodwill and synergy.
The Kenya we want is one in which no Kenyan should leave the country so as to receive the medical care they require. A Kenya that is a world-renowned medical tourism destination. A Kenya whose healthcare bills no longer destroy in a single swoop wealth that has taken decades to create. And a Kenya where every person, regardless of their financial status, will receive the care they need at an institution within the local area, and a Kenya where UHC has become a platform for innovation in developing locally manufactured medicines and equipment. Indeed, as has been identified in the Building Bridges initiative, Kenyans are eager for improvement in healthcare delivery by both government and private providers. The BBI implementation report proposes fundamental and innovative solutions to the health quagmire that Kenya has faced since the beginning of our nationhood. As a government, leaders and partners in delivering the Kenyan dream, we are called upon to do all that is required of us so that Kenya can indeed be that healthy nation that we seek. The scheme we are launching today must be a success. In this context, I urge the NHIF to ensure that the precious funds committed to its custody by both subscribers and supporters are utilized prudently with utmost transparency and accountability. You have heard what Governor Hassan Joho has said here about what he has managed to achieve in just that short space of time, that is saving lives. This is where we want to go. We want to ring-fence this money. We want to ensure, just as we have done in education, we want to do the same in health. That the same manner we ring-fence our education funds, we should now begin to ring-fence our health funds and deliver for our people. It is now my humble duty to declare the biometric registration for the Universal Health Coverage Scheme officially launched. Asante.